my Instagram. I have two of my really good friends here, and we're going to tell you about this entire story here in just a minute. But we are kicking off another episode here with RT Sidebar and JJ the RT and Mindy the APRT and Dakota, who we've known for a while too. But I want to get into that story here in just a little bit. But Mindy, you really have a great question for just kind of kicking us off with what we want to do today.
Oh yeah, so Dakota, what's your last Babcock?
Yes.
Is from Oregon. She works at Salem Health. This is her first time here at Congress, and she has a very amazing story of how she got here. But first, I want to know why you got into respiratory therapy.
Yeah, I actually got into respiratory therapy because I was in EMS before this. And there was a paramedic who was actually studying RT, and that's how I found out about it, because he wanted to be a better intubator and just go through that perspective. And I actually kind of fell in love with it because I was actually diagnosed as a young child with asthma. And I mean, it wasn't bad at first, but now that I'm getting older, it's actually kind of worse. I'm actually on Dupixent now for it. Overall, though, that's where I fell in love with it. And then when I was studying, there was a good mentor teacher that I had. His name's David Citizen. And he just opened my mind to how amazing our body is. And I just fell in love with our lungs and cardio. And it's just really amazing.
Yeah, I fell in love with you when I seen you post on social media a GoFundMe to get you to the AARC conference for the first time. To me, that shows passion and your love for respiratory therapy, and it brought me to tears.
Yeah.
I want to cry now. And I felt compelled to share that story and help you get here, because I know how important networking and learning at an event such as the AARC Congress. How do you feel about getting here? How did you feel about writing that post that you wrote that was so emotional that brought me to tears?
Actually, it was kind of emotional for me too, because I wish I could just come without asking. But when I got hired at Salem, it's just been a struggle a little bit. Just having my husband and my kid, that's two, and money's kind of tight. So I wanted to give it a shot and see if I can get here, because I know how important Congress is and how important it is to build that friendship in this field, and how everything is just so important to me about this passion of sharing with going back and taking this back to my patients and giving them the satisfaction that they need, because I feel like there's a lot of lack with that. They need more education when it comes to things.
Yeah, I applaud you. I applaud you.
That's so amazing that you took a bit of vulnerability and went out on a limb to do this. Let me ask you this. When did you know that you were bound and determined to come to AARC Congress? When did that flip for you?
I could be totally honest with you and say when I graduated last year I wanted to come, but then with knowing that I've been in the field for a year and I've had the passion. I went to the Oregon State Conference, and I really enjoyed it, and I took a lot of initiative from it, and it just kind of drive me even more, and now I'm just all gung-ho.
Yeah.
That's awesome.
You remind me of myself when I graduated as a new RT, and I was 32. I was a mom of three, but I had so much passion. I still have that passion. That's why I'm driving things forward for respiratory therapy, for our patients, and for our RTs. So you're my heart. You're my heart. So.
Well, to be honest, I look up to you as well.
Oh, thank you.
Y'all are gonna make me cry.
I already teared up.
Yeah, I know. It doesn't take much, but this is so fun. This is amazing, and I love the fact that a mentor-mentee relationship is kind of maybe naturally coming together. And had we not utilized the power of social media, had we not utilized the power of just being vulnerable and saying, hey, things are a little bit tight, and if anybody would be willing to share what little bit that they have to allow me to continue to further my career so that I can ultimately do what's best for my patients, it changes an entire landscape. And just like I told you a long time ago that you are a trailblazer, you are a pioneer, you're doing something that is completely unique too, and you're stepping out on a limb. You're creating your own path that allows other people to say it's okay that I'm not fully like I don't have it fully together, and that's it takes a lot of boldness and it takes a lot of self-awareness to be able to say that. And perhaps you now started a whole new movement for other respiratory therapists, other healthcare practitioners who are okay with saying, I need a little bit of help. And they would be willing to start a GoFundMe to say, I want to further my career, I want to further my knowledge base, ultimately so I can do what's best for these patients. And I really think that that is something that is unique. It's divine. It is something that is like I don't even. I'm starting to lose the words for it, but I mean, just to sit between you two and to have that revelation in this moment, it is something that is like. They talk about core memories for children. I think as adults we have them too. And like this is formulating to be a core memory for me. So thank you guys for allowing me to be a part of this. I just want to continue to pull more of your story out. So you were a paramedic or EMT. So you're an EMT and you had a mentor that kind of was guiding you through, and you went through respiratory school.
Yes.
So I'm going to play on like my world a little bit, being an educator and being a teacher. Tell me a little bit about what that time like was as a student, knowing that you're trying to get to something that's a little bit more.
So I did the fast-paced school through American Career College. So it was a lot because it's rushed and it's a lot to handle. And there were some setbacks. I tried to move schools and I got set back, and it was just a few things that happened. Then I found out I was pregnant with Logan. So that was a setback because I was high risk. So that was a setback for me too. So, and then I went back to school and like there was the babysitter issue for a while. So then I was like, I'm not sure I'm even going to be able to finish this. And then my biggest supporter was my husband. He's like, no matter what, you're going and you're going to finish this through. So, because I was in term 5.
Okay.
So, which is mechanical vent.
Oh yeah.
Which, having a newborn and going through mechanical vent is very hard, you guys.
Yeah, it is very hard.
But
it's hard
we
without
did
those
it.
things.
It's hard without those things. But honestly, Joe, the respiratory coach, helped me through it, and I actually would show up to school at 4:30 in the morning and watch his videos over and over and over and over again. And I have a whole notebook that's like this big from his stuff and Oaks and all of that stuff that I threw all of it together to get through. And I had dedication. That's what it takes.
Our passion, our purpose, right?
Yes.
And you have the passion.
Absolutely.
And you know your purpose.
Yeah, and we got to continue to feed your passion.
Absolutely.
Just like we need to continue to feed our students and our therapists.
I
Whether
agree.
you've been a therapist for 20, 30 years to the new grad.
Yeah, the new grads need support for sure.
Definitely. And in year one, you're still trying to translate. What are they talking about whenever they're using this terminology? What is it like? We've got a brand new, like we've got EIT technology right over here over our left shoulder, and it's like, how do I translate EIT into something that I understand? How do I translate occlusion pressure into something that I understand? So it's year one, you're trying to translate a whole lot of terms so that you can understand it. So in year two, because you're moving into year two now,
I will be
right?
in January. Yeah.
Right, so you're moving into year two. How do you plan on continuing to grow and understanding the now that you're kind of past the terminology piece, but continuing to grow in your understanding, because now you don't have the barrier of language.
Right.
You understand the language, and now you can really grow in a skill set in understanding.
Right. I'm a very critical thinker, so like I really like to do like research and like look into things, and like if I don't understand something, I'm gonna look it up to the depth, because not only do I like look at what I'm looking at, I like to know the broad perspective of like inside, outside, down, low, up, backwards.
Right.
I like to know the whole satisfaction that we're giving or that we're looking into to be able to deliver to this. So it's like super, I don't know, intriguing to me to be that in depth. I'm like super critical thinking.
Yeah, and I always say we're learning until the day we die.
Yeah, absolutely.
So continue to push yourself.
I learn every day. I'm not a know-it-all. I don't know it all.
Even me, in a new role as an APRT, I've been practicing now for a year and a half. Every day I experience something new and I continue to grow and learn. And if I don't understand it, how medication works, I go to my supervising physician and I'm like, hey, why are we doing this? Is it weanable stuff? So I'm constantly learning.
Yeah.
I'm not here to say I know everything because I don't.
Yeah.
None of us do.
I do the same thing. There's times where I'll come up, because I've been training in the ICU, and there's things that will come up, and I'm asking Jackie all the time. I'm like, hey, can I get your perspective on this? Or, can you break it down a little bit? So just having those mentors and building that relationship, and that's another reason why I feel like Congress is so important, because you get to build these relationships that you can reach out. Even you, I'm sure I could reach out to you at any point, and you're just like, hey, it works like this, because I've done it with Joe too.
Yeah.
Right.
So just building that strong unity. We're all family.
Right. And you have my number.
Yeah.
So you can text me anytime.
Yeah.
Any question.
Absolutely.
So, a couple of things that kind of come to mind now is when we continue to grow and when we continue to build our understanding with, moving into the year 2, year 3. One of the things that we talked about in one of the last times that we all got together is becoming that practitioner that has 15 years experience, but they repeated it their first year 15 times, so they don't continue to grow, right? And you talked about continual growth. On the back of my phone, it has progression over perfection. I have t-shirts that say progression over perfection, and that is something that I truly live by. And so how would you feel as, going into year 2, how you can continue to shift the mindsets of those that kind of live by that? I've been here for 15 years, I know this inside and out, but they've repeated that first year 15 times and not continue to build. So what would you kind of say to them?
I've always gone by the phrase, I'm not ordinary, I'm extraordinary.
Absolutely.
And that's just where I'm at with it. And all I can do for RTs that are like that is just to keep motivating them to do better. And keep giving them, coming to Congress, when I get back to the hospital, I'm going to build things and present them and just try to get them involved the best that I can. I can only do what I can do, right?
Absolutely.
Yeah.
And one of the things that I kind of encourage the students that I have is they're going to go out into the workforce and they're going to be fighting culture, right? We have evidence-based medicine that helps us make decisions, right? We've talked about it. I think I've talked about it with Matt before, but it's empowering, right?
Yeah.
It's empowering to utilize the evidence to dictate practice, right? And to fight the cultural norms. So how have you experienced that with balancing the cultural norm versus evidence empowering medicine?
I just kind of do my thing, really, to be honest with you. I know what I stand for.
Yeah.
And I know that when I see a patient and I go into that patient's room, I know I'm going in with integrity. And I'm doing it what's best for that patient. And I will sit there and work with them, until we get something that's resolved or something that's a step forward to getting them out of that hospital, and then making sure that they have the proper education when they go home. Because I feel like that's the biggest thing is when they go home, they don't know about things. I have patients ask me, tell me that they don't wash their CPAP mask. And it's and then I go and I print out, I do the extraordinary things, and I'll print out how to clean their mask and hoses, and I explain to them of how important it is.
Yeah.
So
that's important. Education is important, especially bedside before they leave, because sometimes what we do at bedside before discharge keeps them home and out of the hospital.
Absolutely.
Especially proper inhaler use, breathing techniques, and care of a CPAP machine.
Absolutely.
Yeah.
We got that a little bit from our keynote yesterday, Dr. Jerome Adams, right? He talked about patients that are discharged from the hospital and then they go home to the same situation at home, but how are they going to change their environment if they don't know they're unaware of what they need to change.
Right.
So it's fantastic that we're utilizing our time to educate and develop that understanding from that perspective.
Absolutely, and I want to keep educating.
Yeah.
Like, I want to teach students coming in, like, it's important to educate and start doing it now. The knowledge you know,
Yeah.
share with family. Like, the knowledge you're studying, practice it. Because
Yeah.
the more you practice it, it becomes easy.
Yeah, I think utilizing the time when you're in a patient's room, just don't sit back on your computer and act like you're charting. You know,
Right.
Yeah.
educate, talk to your
Yeah.
patient. You might find out something that the physicians don't know,
Yeah.
and then you can bring
Absolutely.
forth to that physician. It's very, very important. So
It is.
utilization of time management
It is.
at the bedside,
Absolutely.
and when you engage with your patient, hopefully it brings back the passion. If you've lost the passion of respiratory, it brings it back, and you remember your why of how you got here. Yeah.
It's interesting because with time management, it's one of those things that we're trying to teach students so often is managing time. And I kind of challenge them a little bit. I'm like, you can't change 60 seconds in a minute.
Yeah.
You can't change 60 minutes in an hour. You can't change 24 hours in a day. But what you can change is you can change your decisions that you make within that time frame that you have. So are you deciding to sit back and hide
Yeah.
behind the computer to chart, or are you deciding to educate your patient? Maybe you don't have all of the information yet, but when you're in between rounds, are you trying to develop your understanding, your knowledge base, so that you can share that with your patients when you have that time that you're performing those therapies? So we have so much time that we can utilize in our 12-hour
Right.
shifts. And you know, it's not the time that we can change, but what we can change is our decisions and our actions within a given amount of time.
Absolutely.
So those are some of the things that, like, it shows that you're developing, or you have developed the right decisions, right, for impacting the student or the patient as much as you possibly can.
Yeah.
That's awesome.
Yeah.
Thank you.
See, I'm teary-eyed. I'm teary. You guys brought me to tears.
We're not trying to.
I know.
It's not. We're not trying.
It's just my passion coming out, guys.
It's
Yeah,
mine too.
absolutely.
I'm on the
and
verge.
it's blowing on her. So if I can make somebody else love our profession, I've done something right. And it makes me cry.
And you have.
Yeah.
Because seeing you do the things you do is really honoring. Like I tell Jackie all the time, I want to do that.
Yeah.
One day, I do.
You want to be an APRT?
Yeah.
Oh, goodness.
Stop.
Dakota Babcock, APRT of the future. I'm so
Absolutely.
excited.
Calling it. Put it in. Put it. I mean, speak it into
Yeah.
existence right now. So before we started this event, this podcast, I kind of heard some people over my shoulder saying, "Yeah, Dakota's about to do an interview with Mindy, the APRT, and isn't that just so awesome, right?" And they're just hyping you up over my shoulder right now. But like, who is this posse that's with you?
Mindy?
No, well, these people.
Oh,
on my
the
Over here.
people back here?
Yeah.
Jackie, she's our clinical educator. And Mickey, she's our NPS, which is another aspect that I actually really love. I love NICU.
Yeah.
I did my clinic rotation. I also worked at CHOC for a while, but I did my clinic rotation there too. And it was like an honorable experience to work with the babies.
It takes special people to work with babies.
Absolutely.
Yeah.
But Jackie's another mentor of mine that she's done a lot of things, and I kind of want to be, on that aspect.
Yeah, Jackie's amazing. I met Jackie for the first time last Congress in Nashville, and we actually Marco Polo each other. It's an app where you can talk to each other and send it all the time.
So you use Marco Polo.
I use Marco Polo.
So it's so funny. Like 4 years after I graduated with my associates, all of my buddies, right? We're all starting to kind of go different places, and it's like the Snapchat before Snapchat, right? You actually send a video. You send a video. Look, we have
It's Jackie.
right here. We're talking about Marco Polo. Are you
IRL.
familiar with Marco Polo?
I'm very familiar with
Very familiar with Marco Polo.
So
It's my main avenue of communication.
So she actually Marco Polo'd me when Oregon played Ohio State.
Okay.
She went to the game,
Oh, stop
and
it.
I'm, everyone knows I'm Ohio State. I'm a Buckeye.
Through
Well,
and through.
I have to give it to Oregon because they beat us.
That's right.
It was a very, very good game. It could have went either way. But now it's Oregon and Ohio State back to back.
So we are all. Are you as big of a football fan as these three over here?
I am not.
So just
I'm a baseball fan. Go Dodgers all the way.
Let's go baseball. I don't know about the Dodgers, but we'll just keep it for football for right now because that's the season we're in, right? So every game before every Saturday, I'm texting Mindy. I'm like, hey, what's it looking for Ohio State this week? And I said we've got it. Like, there's a big game coming up before the Oregon game.
Yeah.
And I'm pretty sure you sent me her picture of her being at
the game. I did. She sent it to me, and she's like, "We're here," and I'm like, "Oh my gosh!" And then I text her afterwards. I was like, "Congratulations, go Ducks!" Because they beat Ohio State.
It was a great.
I was surprised at the outcome of that game as well.
Yeah.
The whole time we were all on the edge of our seats because
Yeah.
it was like, oh my gosh, this is really happening. It was fantastic.
A really, really good game.
Yeah.
So, okay, let me kind of wrangle us back in. So, Jackie, we were just talking about the posse that Dakota has and the fan club that's in her corner. What's it like having somebody like Dakota who has the desire to want to come to Congress, that has that desire to want to develop to be a better therapist for her patients?
Well, I can say it's so exciting. I mean, that's the obvious thing. It's so exciting as a leader and as somebody who has wanted to get people engaged for a long time. And you always have people here, people there, and they have a passion for a while, or they fizzle out, or you just never can tell what's going to be a spark for somebody. And the moment I met Dakota, I knew that she was ambitious and eager and excited. And as a leader, it makes me look at myself and think, what can I do to really nurture where she's at, right? Like, I wish that when I was a young professional that I would have had somebody that really nurtured my excitement, because I felt for me I was kind of left to my own intrinsic motivation, which is huge, but it's really awesome to have kind of your posse. And I've been fortunate over the years to have people in my corner like Mindy, like Maria Madden, like Mandy DeVries, and I feel so like there was a talk today on imposter syndrome, which is huge, I think, for a lot of us. And for me, that's what I feel like when I'm sitting in a room with these women. I'm just like, how are they my friends? Like, how do I get to be supported by these amazing women that I look up to every day, every step of the way? And so there was a moment yesterday where Dakota looked at me and she's like, that's how I look at you. And I'm like,
My heart.
It's just like, that's an opportunity for me to help her. And it's just really exciting to see people get engaged and get excited. And
You're okay?
Oh my God, you guys are ridiculous.
Been teary-eyed this whole time.
You guys are ridiculous.
Well, being inspired comes from a lot of different places, right? And for all of us, it's different. And so I think when you feel inspired and when you see other people that are inspired, it's like you want to grab onto that. And that's why I come to these things and try to network with people, is because I don't get a lot of this kind of inspiration in my day-to-day or in my regular workplace or whatever. And coming here is like so revitalizing. It's so inspiring. It's like, I know that there's people that I want to be like everywhere I turn,
So you guys are calling me out for getting misty. And that's okay, because I mean, I'm not a big hugger, but it's the passion, right? You come to these events, you come to Congress because there's so many people that are walking the passion that either you share or that you want to put into somebody else. And those are the things that are absolutely amazing, and those are the things that we want to continue to build. And the more people that we can latch onto and kind of throw our arms around to embrace and continue to bring alongside with us, the more we do that, the better we will be as a profession, the better we will be as healthcare providers, the better the patients will receive care. So I just love the fact that we are continuing to find more people that have that passion and we have resources now that perhaps we didn't have when we came out to foster that ember, that fire that we can throw fuel on and allow them to go whatever avenue that you want to go into. Like if you want to get into like hospital education, if you want to get into academia, if you want to be an APRT, like you have people around you that can show you the path that you need to take in order to get to whatever next milestone you're trying to get to. So that's one of the things that I truly love about this is the networking, the collaboration that comes together.
Yeah.
I think that we're doing a lot better at recognizing the broader range of opportunities for RTs too, and I appreciate that because I do, as someone that has ever since I was young, it's kind of like I stick with something till I feel like I'm really good at it, and then I kind of move on to something else. And I really didn't think that I would stay necessarily being an RT for very long because I figured I'll get good at that and then do something else.
Right.
Well, turns out you can't just be the best at being an RT. There's like so much to learn. But as an industry, I think seeing like research and seeing industry and seeing all these different places that can spark, different things, I think that respiratory is doing a better job at opening those doorways. Because when I first started, I felt like I was told over and over, there's just not a lot of opportunity as an RT, unlike nursing where you can get into administration or blah, 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 or work here or there. And it's like, that's really just not true. It's just different, There's different opportunities, but there's still so many for us.
So, Dakota, what's it like having somebody like Jackie in your corner that is kind of fueling that fire, that's throwing gasoline on your fire? What's that like?
Oh, it's amazing. I couldn't be any more grateful, and I'm distraughted of how grateful I am because it's just, she's an amazing person. She's that one that's a really good person to have in your corner.
Yeah. I agree with that. I agree with Jackie. Jackie's the best.
Aww.
Yeah.
And Mindy too. She's also a good person to have in your corner, and I'm glad that you're here, and I'm glad I met you.
Yeah.
And I hope this all continues to grow and we get closer.
Speaking of which, we have an unknown history that I just found out today.
Yeah.
Between JJ, myself, and Dakota.
Yeah.
Absolutely.
So we're gonna kind of pull that back. Let's pull that curtain back, and we're gonna set the scene back in 2021. We're in the height of the pandemic, right? I have long hair, right? Usually rocking a headband, maybe some sunglasses. And I'm living on an island, right?
Yep.
And it's completely different than somebody that's got a semi-collared shirt and a mustache now. But let's start with you, Dakota. What was that timeline like in 2021 when you and I first met?
Well, I was still very eager because I was so excited about starting RT school. I was in my second term when I got onto that podcast or the FaceTime.
We called it The Bridge.
The Bridge, yeah. So it was really honoring just to hear all of the RTs get together and collaborate, and I'm glad that I did it. Just to be able to hear that side and kind of open my mind to new things. I always like getting into things like that, so it was really cool just to. And then when I started following you, and then just started like getting into that, and then now I'm here meeting you, and it's exciting.
It's crazy. Mindy, you want to share kind of what your timeline was like in 2021?
2021, I just finished grad school. I graduated from grad school. JJ and I had started talking a little bit before, like when I started the program, and he was like, this is big. This is going to be big. But after graduation, he actually was one of the first people to interview me for the APRT. It was actually you and Joe. Yeah, so we did an interview. I think there was 4 of us who had graduated from the program. And, we talked about our experience for being the first program, going through a global pandemic, and, we were done. So how did it go? JJ and I have waited 4 years to meet.
4 years.
4 years. But he has been my biggest supporter through this whole thing. And he told me, I'll let you tell the story, but he told me something back in 2021, and it has really come true, and it's, it's heartwarming. for myself that I was able to accomplish something so big. I'm very humbled and honored because it's for a bigger purpose. It's for the betterment of respiratory therapy in general, our therapists, and our patients. Yeah.
So for me, it was jumping on Instagram Live once a week, a couple times a week. Respiratory coach and I, we actually met in grad school. So he was doing, the normal introduce yourself, first assignment in grad school. And in true coach fashion, he did his in a video. And here I am schlepping this paper of an introduction of who I am. And I'm like, he's doing and saying everything that I would like to do. And why not do that?
Yeah.
And so the more we talk, I reached out to my instructor. I said, hey, who's this Joe Lewis guy? Who is this? Can I get his contact info? We end up exchanging information, have a phone call. Our first conversation, I was in orientation on the island, and I'm sitting outside of HR taking this phone call for 45 minutes, and we're just talking, philosophy and what we think the profession can be, and just making these grandiose, imaginative ideas as to what we can do. And then we started having those phone calls regularly. Started keep having those phone calls. I was like, well, what if we just got online and did a live and allowed other people into our phone calls? And then that's when you started to join. And then I don't know exactly how we made contact with the Ohio State. I don't know how we made contact with them. But somehow Joe and I were able to get a hold of either George or Sarah or somebody to get all your cohort together for us to interview you guys. And I didn't know that this was going to be as prophetic as it was, but I just knew that I wanted to ask a big question to start, because this was the very first cohort of something that has been in the works for years.
Right.
And I knew that they were going to do something big. So my question was, do you know what type, that you are a trailblazer? Do you know the impact that you are going to be making? And it was coming out like Mike Tyson, not this past weekend, but back in the 90s when he would take people out in seconds.
Yes.
Right? And that was the question that I asked, and that's what's held true, is you have you blazed the trail that is leading to more APRTs that are going to impact healthcare throughout our VA system. That's going to transition into outside of our governmental system. You are now creating a trail and a path of your own. You started this GoFundMe just so that you could get here. That is creating a path and a trail that nobody else that I'm aware of has ever done. And now there's going to be more practitioners, more clinicians that are going to do just what you did, so that they can get the betterment of this experience, so they can bring it home, so the patients can get the best possible care. So I'm humbled by this group that I have around me, because you guys are blazing trails everywhere you go, and it's not going to stop. It's not going to stop. So continue doing what you're doing. If I can encourage you, continue to do what you're doing, because this is the fuel that we need as a profession to continue to progress. We're never going to be perfect. They call it a practice because we never get it perfect.
Right.
There's always going to be new evidence. There's always going to be new devices. There's always going to be new interventions that we can utilize. There's always going to be new interventions that we can utilize, that we can use for our patients. So continue doing what you're doing, Dakota.
Thank you.
Continue doing what you're doing, man. Jackie, continue doing what you're doing. You are inspiring so many other people to do so much. And I'm so thankful.
I love how this has all come full circle, because I didn't know that you knew JJ. And when I was talking to JJ and Matt about bringing you on, he probably had no idea. He knew your name, but he probably didn't
Right.
have any idea that you guys had met up in 2021.
Yeah.
So it is full circle here at AAOC Congress Orlando 2024. This is where miracles and surprises and passion happen.
Yes, absolutely. I agree.
Yeah.
All right, so now the heavy stuff is done.
Yes.
Okay, shake it off. All right, we're gonna go around the table, and we're gonna ask. All right, so is there a TV series on Netflix or Hulu or
Oh, jeez.
Disney Plus, right? Whatever your streaming platform is, what TV show are you into right now? We'll start with you, Mindy.
I'm going to sound psycho, but I like murder mysteries. I like the serial killer episodes, all of them, between Jeffrey Dahmer and, yeah, all of them.
And we found out that that falls right in line with female healthcare practitioners.
That would be me.
That falls right in line with that whole class.
I don't know. I don't know if it's an obsession because I've actually had to deal with some in a hospital setting before. A lot of them have stemmed from Ohio, and that's true. Honest to God, that's true. But I really enjoy them. I try to figure out how they get that mindset because they're rare, but they're there, and I want to understand, but I don't think we'll completely understand. Yeah.
Jack?
Turns out there's a lot from Oregon too. I used to be on that same track. I would go to sleep listening, watching Snapped every night. But to be honest with you, I'm looking for a good series right now because the last thing I watched that I felt like was kept my attention really well was I did watch the House of Dragon series, and so since then, I mean, my guilty pleasure is Love Is Blind.
Oh, mine too. I love that.
You do?
I do.
I'm only on like the second episode of the most recent season.
Oh, that
so.
that one gets good, but I'm like, where do they get some of these people from?
Yeah.
And this one is actually in Washington D.C.
Is
and
it
most
really?
of them are from Baltimore.
Oh,
How
nice.
funny. Well, one of my favorite seasons was when they were
Yeah.
in Seattle, Portland
Yeah.
too. And I'm like, where was this guy
That was
my
good.
whole life?
All right, Dakota, what's yours?
To be honest, I'd say looking for one because I mean my son takes up all my TV time. So
Yeah.
it's a lot of Lightning McQueen.
Yeah.
Oh,
I remember those days. I remember those days.
So for me, it comes out every Tuesday. It's a brand new TV show. It's called High Potential. High Potential is on Disney Plus. She's a savant. She's a like uber smart that has photographic memory, and she puts these police cases together, and she's a consultant for a police department. So she uses her wit, she uses her high potential to solve these cases, and so that's the one that I'm on right now. Well, we usually watch that one on Thursday night because the TV gets commodored by my wife, and we watch. And we watch. Matt's in the background calling me a nerd, but that's fine. I'm not trying to kill people, but my wife commodores the TV on Tuesday nights, and we watch Dancing with the Stars.
Oh, that's good too.
So Tuesday night is Dancing with the Stars. Wednesday we're at church. Thursday is when we get caught up with High Potential. So that might be the next one.
Yeah.
that looks
Yeah.
good.
Yeah.
Yeah, that's fun.
All right.
Do we have any shout outs?
Shout outs.
Shout outs.
Yeah, we're gonna start this way.
Oh boy. I guess shout out to you for everything. I mean, being here, being a mentor, enjoying this experience with you has been great.
Aw.
So thank you.
Yeah. You have a shout out?
Oh my goodness, I have so many shout outs. I feel like so many people have impacted my life for sure. I'm trying to think, God, I feel like overwhelmed with like so much in my head right now. Past him, Indian, I'll come back. I'm like, everybody, all these names are swirling through my head.
So I want to give a shout out to Dakota. She's brought me to tears multiple times this year. And I'm honored to know you, and I love your passion, and I want to help you grow.
Thank you.
So my shout out is to you.
Thank you.
We're all crying here.
Stop it.
I mean, I want to shout out to like girl power. Can I do
Yeah,
that?
that's
I just love.
That's fine,
JJ,
you're
you're
fine.
fantastic. But I have to say, like, the support of the women in this profession over the last, I would say, 5 to 7
Yeah.
years of my career have just 100% changed my life. And I'm so grateful for all the women that have been supportive and helped me to grow.
For me, Matt did it before I could yesterday, but shout out to my wife. She is one of my biggest supporters that just loves the people that I'm surrounded by. So I just love the fact that she fully has embraced the craziness that is JJ the RT and all of the people that are kind of along for that ride. She is along for that ride as well. But as far as my respiratory folks, shout out to Charmin Lamka and the Phil Award and the Faces Foundation.
Yeah.
What they do to bring awareness and to highlight and celebrate those that are going above and beyond is amazing. And if you're not part of the Faces Foundation, and if you don't have a Phil Award recipient, go check out their website, go check out what they stand for, because it is something that we need to continue to celebrate.
Yeah.
It's phenomenal artists.
I think Dakota was just nominated.
I was.
She was
by
nominated.
patient, actually.
Yeah.
Yeah.
So,
It was really honoring, actually.
so that's amazing. So congrats. That's
Thank
a
you.
huge honor.
Thank you.
Absolutely. Well, that's it for us here today
Thank you,
at
guys.
AARC Summer Forum 2024 in Orlando. Thank you guys, Jackie, for the impromptu out and come through. Thank you guys so much
Yep.
for being here. We are going to see you guys next time.
Bye.
Bye.
Thank you. That was so fun. Oh, that was fun.